Well, I think if you're done having children, then it's at least worth talking to your physician about. Everything is relative in terms of how disruptive a period is for your life. But with any kind of procedure or medical treatment, you want to weigh the risks and the benefits. Some women are probably going to put up more or tolerate more than others. I've had a couple stories that seem to stand out. And I think when you hear these stories, you realize what women have put up with for so many years, and we just don't have a clue. One lady was telling me a story how she was in her best friend's wedding. Of course, she had a light gown on, and that was the day when she had this just horrible accident through the gown and everything. And I just can't imagine how embarrassing that must have been, not only for her, but then for her friends. So situations like that we can improve and prevent are very important. She was ever since that one occurrence, she's dreaded being in public, going to church, going anywhere, and it's made a very significant impact in her life. I had a patient who actually works at the local casino, and she works in the kind of the vault area where, of course, she's under video surveillance all the time. She has to wear kind of a jumpsuit, so she can't hide any money, I guess. And, of course, during her menstrual time, then it's very hard because she has to get out, cleared out of the vault, get out of her jumpsuit. And this happens frequently and disrupts the whole routine to the point where she was fearful of losing her job. So again, something you would never normally think of, but yet it made a huge impact. And again, she came back and was so thankful that her problem was solved. I had another lady who actually was on a construction crew. So she's out working with the guys out in the boondocks. And of course, now what does she do? There's no facilities. And of course, the guys are not very understanding. So again, it was a huge problem for her every month, and she wanted to do her job and do it well. It really prevented her from doing that until she had her ablation, and it made her life way less stressful, her work way less stressful. So again, I think huge impacts can be made with a very simple, safe procedure. I think the best part of the NovaSure procedure for me is the patient's reaction, that we can offer something they weren't expecting, something that's very successful, simple, and safe. For the patients, the kind of surprise, if you will, that we can solve their problems in a way that is much less invasive, much safer, much quicker, cheaper than they ever imagined.